Hi, it's Gayle Palmer here, the osteopath at the Living Elements Clinic. This week in October every year is all related, or the previous 2 weeks actually, is all related around your spine, your joint health, your tissue, your tendons. So I thought I'd give a little update on your spine. Here is my mini model of the spine, human spine. Although some animal spines are remarkably like ours and some are very different. So let's just start at the bottom. Why not? So this is the pelvis. This the pelvic bones are made up of 3 bones. The sacrum in the middle, which is part of the spine, with the coccyx right at the bottom here. And then these 2 large structures which have a joining, a joint, the symphysis pubis in the middle at the front. And these are actually made up of 3 bones. The ilium at the top, the ischium at the bottom, this is where your sitting bone is, and the pubis, these 2 arms here, form and connect together right in the joint, which is your hip joint. I know when my patients come in and they're describing hip pain, it's often around this area, around the muscles in that are attached to the ilium. But in fact, the hip is much further down than you would imagine. So that makes up the ring of the pelvis. Almost all pelvis models are male, so it's a slightly different shape in females. It's wider across so that you can transfer babies through them. And then you have the sacrum down the front here. You can see here where the nerves come out. These are the sacral nerves for the body, and they supply mainly the pelvic organs, pelvic floor, etc. And then coming up the spine, we have these larger vertebrae here, which if I turn to the side, there we go, you see that. We have lumbar 5, 4, 3, 2 and 1. And then this area here is a junctional area, the thoracolumbar joint or the dorsolumbar joint. The lumbar spine is usually, in health, flexed backwards, so it has a concavity to it. And then as you come up the spine, it becomes more flexed forwards. And this is why this junctional area, the thoracolumbar joint, is or can be such a problem. It is also the attachment for the diaphragm, and the last of the ribs, the 12th rib, comes off at this point here. So this can be an area that gets very tight if we get stressed, anxious, if we're doing a lot of lifting, for instance. This is an area that can be under strain. And then as we go up the thoracic spine here, there are 12 vertebrae in this lot. They're a little bit more delicate, and they also have, and I'm hoping you're going to be able to see this because it's relatively clear on the model. You can see these are the transverse processes. You have the vertebral bodies here, and then you have these side projections, which are the transverse processes. They are for muscle attachment, but in the thoracic spine, they also have the ribs attached to them. So each rib sits just between the vertebra here and then attaches to one of the vertebrae of the transverse processes and then comes out and round the front. And then easily gets attached to cartilage around your lower ribs here, or attaches into the sternum down the front of the vertebra, sorry, the front of the body. And then coming further up, you tend to get a more pronounced flexion curve in the upper spine. For some people, this is very exaggerated, which is not good. And then you have the cervical vertebra, the neck. Again, there's quite a marked junctional area here, you can see that really clearly, like it jumps off a cliff. And the cervical vertebra are quite different in shape, really, to other vertebrae in the spine. They are quite small, quite delicate. This is from the front. But they have the spinal cord running all the way through, as it does most of the rest of the vertebra, down to about L1, L2 down here. And then there's a tail of nerves that come from here down and exit as necessary for the abdominal and pelvic nerves. Now, the nerves up here in the neck supply your arm, your upper chest, head and neck, which means there's a lot of information, and they are big nerves. So the foramen, the holes that they come out from, can be very congested. And you also have the vertebral artery. You can see that just going through those vertebrae. There's a little canal that they go through. So this cervical area, if you get a lot of wear and tear, if you abuse it, you've had car accidents, for instance, other injuries, can be a real area of problem, because not only does it have the nerves that supply top half of your body, really, but of course the spinal cord going through goes and supplies the rest of your body. So as an osteopath, we see problems in this area quite frequently. In fact, all of it, because what do osteopaths do? We treat the back. We treat the spine, we treat the vertebra, we treat the discs between each vertebra here, which are these grey areas, which are like a speed reducer and a support system so that you're able to articulate. We treat the musculature that supports and surrounds it. We treat the fascia, the investing tissue, which gives shape to a lot of the body and provides, a good way of thinking of it is it's like cling film, and it surrounds different tissues, and then other tissues are bundled up together. So it keeps everything neat and tidy, really, but it's also quite a strong support system for your body. So all in all, excluding the head stuck on the top, there are 7 cervical vertebra, 12 thoracic vertebra, 5 lumbar vertebra, 5 sacral vertebra, and then between 3 and 5, usually 5 coccygeal vertebra, which are little tiny people, but formed in one bone. And they all sit between these innominate bones of the pelvis, and then you have the axial skeleton, the shoulder girdle coming off from there, but not actually attached to the spine. And then you have the hips and the lower legs from the bottom here. So I hope that's been helpful to you, interesting to you. This time of year, as I said, it is all about World Spine Day, bones and joints, back pain relief, etc. Osteopaths are not only experts and trained in this over many, many years, but we have a large range of treatment options that we're able to offer to help get you back to better health and get you back to life. So if you are struggling with any of those things, or you have concerns about them, maybe you think you're getting osteoporosis or something like that, please come and speak to your local osteopath. We're here to help. We know what we're talking about, and we don't want you to suffer more than you have to, particularly at the moment when with the coronavirus around. Life is looking a little bit different for many people. They're not able to get out as much. They're not able to do some of the hobbies and have as much contact with friends as they would normally do. And this is putting a real dampener on your activities, but that also changes how we use our body, what we use our body for, and ultimately that changes our spinal health. So if you're concerned about that, or you're struggling with your body, please get in touch with me at the Living Elements Clinic near Chichester. I'm here to help. Your health is my priority. Take care for now.